Okay. Is selling syringes to IV drug users enabling their drug addiction, or is it a way to prevent the spread of many illnesses and diseases? While this is a highly ethical debate, I'm here to argue that by allowing pharmacies to sell syringes to anyone, mostly over the age of 18, without a prescription, can and does prevent the further spread of viruses like HIV, AIDS, and Hep C. Statistics show that in the US, in 2011, ages 13 years and older, 2.6 of the population were IV drug users. That is approximately 6,612,488 people. Among that population, about 55 per 100,000 were new IV diagnoses. 2,147 per 100,000 were currently living with HIV, and 43,126 per 100,000 were currently living with Hep C. The stats I just read are alarming in the amount of people who participate in this act, but because of unsafe practices every year, we spend $11 billion for healthcare for illicit drug users. Making syringes available to anyone, but especially IV drug users, can, number one, prevent the spread of viruses like HIV, AIDS, and Hep C. By helping to prevent the spread of these viruses, we obviously cut healthcare costs, but also keep people from the horrible effects of these viruses. Programs like syringe exchange can not only help prevent spread, but oftentimes can lead to people overcoming their addiction, and many, in turn, help others. First, I'd like to explain why sharing needles is so dangerous. Sharing needles increases a person's risk to contract HIV/AIDS or Hep C. HIV/AIDS is an autoimmune disease that does not currently have a cure. Currently, there are many different costly treatment options for people infected. In the US, over 1 million people currently live with HIV, and 1 in 8 don't even know that they're infected. Hep C is the current leading cause of death from liver disease and the leading cause for liver transplants. Hep C is 4 times more prevalent than HIV/AIDS in the US and now kills more than AIDS. Unfortunately, about 75 of these people don't even know they have Hep C. But luckily, there are many different treatment options that people have that often lead to a cure. Proper care for these viruses include routine doctor's visits, various lab work, various scans and scopes, and costly medication. Let's discuss how these viruses can greatly affect your body if left untreated or not properly managed. HIV, if left untreated, can lead to AIDS. Life expectancy of a person with untreated HIV or AIDS is about 3 years. Cirrhosis is hardening of the liver, which can lead to a liver transplant. Liver cancer, or ascites, which is buildup of fluid in the body. Varices, or bleeding in the esophagus. Now, let's discuss some ways communities are trying to assist IV drug users in safer practices. These include allowing pharmacies to sell syringes and syringe exchange programs. All but 2 states allow pharmacies to sell syringes to anyone over the age of 18. Currently, there are around 200 syringe exchange programs in the US. These programs not only provide clean needles to IV drug users, but proper disposal of used needles, testing for HIV, AIDS, and Hep C, and education for the viruses, overdosing, treatment options, and proper vein care. They also help you find rehab programs if you want them. Even though the law allows the sale and access to clean syringes, it is still a highly ethical situation. I would like to read some quotes that I found from a website for people that have participated in needle exchange programs. Needle exchange has saved the many lives of my friends by keeping them HIV and hepatitis C negative. By providing them with safer injection education and by linking them to drug treatment, one friend started using at age 14 and stopped using at age 22. He is able to live a full, healthy life in large part to the assistance he received from needle exchange programs that gave him non-judgmental support and education and gave him access to supplies that kept him HIV and hepatitis C negative. His sober life is richer because he does not have to contend with chronic illness. Without needle exchange in his life, and life in his 30s might look very different now. 9 years ago, I was a junkie looking for a fix. I found my drug but had no utensil, so I went to Walgreens and asked for a bag of needles like I had done countless times before. This day was different. The pharmacist would not sell them to me because I did not have a medical identification card saying I needed them and because I was diabetic. No, I needed them because I was a junkie. Unfortunately, ignorance won, and I left empty-handed. I walked to the dope house and spent the next 10 hours sharing a dirty, dull needle with two other junkies who I had never met until that very day. Needless to say, 6 weeks later, I was living in a clean and sober house and had graduated from an inpatient treatment program. I received a call from the clinic to come in for some tests. I had hepatitis C. I do not know whether I got the hep C from those junkies on that day or if I gave them the disease. I will never know, and it doesn't matter, because if a clean needle is not available to an addict, they need their fix, they will and do share, no matter. I first injected in high school. It was a small miracle I didn't get infected with HIV or hepatitis at that time. Since I had no idea where to get sterile syringes in 1992, when I was in college, I found an underground needle exchange. They helped me kick heroin the first time by checking up on me and referring me to a non-judgmental medical doctor. I was so appreciative that I started volunteering with them. I relapsed many times after that, but continued to volunteer through it all. While I was using, I had access to all the new needles I wanted, and used a brand new needle for every hit. Today, I have been clean for 7 years, still do not have HIV or hepatitis, and have a master's degree in public health. I intend to use my MPH to help others and other injection drug users from getting HIV and hepatitis also. Being an injection drug user was a small part of my life, and I am forever grateful it did not ruin all of it. Needle exchange was the beginning of my recovery. I was a participant at Prevention Point, Philadelphia for 7 or 8 years before I reached a point of being ready to stop using. On December 12, 2007, I will be celebrating 10 years without using drugs. In May 2008, I will graduate with a master's degree in social work. I had been homeless and jobless for more than 15 years of my addiction. This is a miracle, and harm reduction was the beginning of my recovery. I used the needle exchange for many years. It kept me safer and healthier than before I used it. I was also able to avoid getting hep C, which is a miracle in and of itself. Already being HIV positive, I didn't want the additional burden of having HCV. As a public health program, needle exchange has an extraordinary impact. It kept me out of the public health system much of the time, easing the burden on the city's health system. Because I wasn't getting sick as often, wasn't reinfecting other people by sharing needles, and wasn't practicing harmful reduction principles. Eventually, I went into a harm reduction program, which weaned me off the drugs. I am so grateful for the exchange program that I began volunteering with the local needle exchange program of the SFAF and have done so for 18 great months. I am now able to give back to the people in the organization that helped me in the past. It is a great feeling. Thank you. I would like to review with you, while there is still a stigma for those who are IV drug users, and it has to be their choice to want to get clean and stay clean, that there are many advantages of pharmacies selling syringes and syringe exchange programs. They help reduce the spread of HIV/AIDS and hepatitis C. They can help reduce the amount of money we spend on healthcare for these viruses, and most importantly, they can help people get clean. And here in Denver, there is the Harm Reduction Action Center that people can go to receive help, and where people can go to volunteer. Thank you.